pulmonary valve stenosis, a rare heart condition, often goes unnoticed in adults, but treatments offer hope. Imagine your heart struggling. Its pulmonary valve, the exit to your lungs, is pinched shut, restricting blood flow. This forces the heart to work harder, leading to symptoms often mistaken for fatigue or stress. Key indicators include shortness of breath, unexplained chest pain, and even fainting. Many adults with mild PVS may not experience symptoms until their 30s or 40s as the valve stiffens. Fortunately, treatments like balloon valvuloplasty can widen the narrowed valve. For severe cases, minimally invasive valve replacement procedures are saving lives, offering higher success rates. After treatment, most patients experience improved energy and can return to active lives within weeks. Pulmonary valve stenosis in adults may be rare, but with medicine, it is not a life sentence. Consider screening for hidden heart valve issues, even if you feel healthy. Share your thoughts.